Hello guys, hello ladies and gentlemen, it's me Anil Gurung. Today I am going to talk about short note on squamous cell carcinoma. Squamous cell carcinoma is most common neoplasm of oral cavity. It is also known as epidermal carcinoma. It is defined as malignant epithelial neoplasm exhibiting squamous differentiation as characterized by the formation of keratin and pinches of intercellular bridge. Squamous cell carcinoma is mostly differentiated from squamous epithelial cell and which is characterized by formation of keratin and intercellular bridge. Formation of keratin and intercellular bridge is the most common features of squamous cell carcinoma. This is most common malignant neoplasm of oral cavity भनिसके. The most common malignant neoplasm of skin is basal cell carcinoma, but in oral cavity, squamous cell carcinoma is the most common. The etiological factor. The etiology is unknown, but number of etiological factors have been implicated. Right? The strongly associated etiological factors are tobacco smoking and chewing. Tobacco smoking and chewing is most common etiology of the squamous cell carcinoma, which leads to oral cancer. The others are chronic alcohol consumption, human papilloma infection. These three are strongly associated etiology of the squamous cell carcinoma. The widely associated squamous cell carcinoma, the widely associated etiology of squamous cell carcinoma are chronic irritations from ill-fitting dentures. Squamous others are some mucosal fibrosis, nutritional deficiency, especially vitamin A deficiency, poor orodontal hygienic, exposure to sunlight, which cause especially in lip cancer, Plummer-Vinson syndrome. Plummer-Vinson syndrome is this is commonly associated with iron deficiency anemia. The synonyms or another names of Plummer-Vinson syndromes are Patterson-Kelly syndrome and syndropheric dysphagia. Epidemiology. Squamous cell carcinoma is most commonly occur in male, which is 2:1 in ratio, and the age is more than 40 years of people are mostly affected by squamous cell carcinoma. Clinical features. Sore in mouth that doesn't heal is most common symptoms of squamous cell carcinoma. Pain in mouth. Early carcinoma appear as white lesion, and it also develop red lesion, even as exophytic mass. There is maybe red and white lesion both, which expressed as the exophytic growth or exophytic mass in oral cavity. Erosion or ulcer is a most common clinical features. Ulcer has irregular papillary surface, elevated borders, indurated margins, and hard base on palpation. Actually, ulcerलाई define गर्दाखेरि we have to define as shape, size, each floor and base. The squamous cell carcinoma को अल्सरमा चाहिँ सेपको कुरा गर्दा shape is oval or circular, size is varies, each is rise or inverted, floor is necrotized floor, base is indurated, which is hard on palpation. Mobility is cannot be moved, later is become fixed. The most common site of squamous cell carcinoma is lateral border of tongue and ventral surface of tongue. Hey, this is the most common affected site, and lips, floor of the mouth, soft palate, gingival ridge, buccal mucosa are the affected site of the squamous cell carcinoma. This first figure, this is the early with this figure, second figure showing that this is early squamous cell carcinoma on the lateral border of tongue. And this figure is showing that, oh my god, this is showing that squamous cell carcinoma presenting as a red mass on lateral border of the tongue. The first figure showing that early squamous cell carcinoma of floor of the mouth, and second figure showing that squamous cell carcinoma presenting exophytic growth or tumor on lateral border of the tongue. and later figures showing that late squamous cell carcinoma on dorsum of the tongue. The histological features: increased mitotic activity, well differentiated keratin pulse, that is abnormal keratinization, hyperchromatic nucleus, that is due to increased high ANC ratio, pleomorphism, connective stoma with chronic inflammations are the histological features of squamous cell carcinoma. Histologically, it is can be divided into 5 subtypes, that is well differentiated, mildly differentiated, poorly differentiated, basaloid squamous cell carcinoma, and varicose carcinoma. The metastasis of squamous cell carcinoma most commonly involve submaxilla and superficial and deep cervical lymph node. Treatment: actually, surgical excision, radiotherapy, and chemotherapy is the treatment of choice in squamous cell carcinoma. We give wide excision to CM negative margins, and we also can give block dissection. In chemotherapy, we can use methotrexate, vincristine, bleomycin type of medicine. है स्क्वामस सेल कार्सिनोमा इन्भेस्टिगेसनको कुरा गर्न बिर्सेछु. इन्भेस्टिगेसनमा चाहिँ स्क्वामस सेल कार्सिनोमाको चाहिँ इज बायोप्सी एन्ड एफएनएसी फ्रम लिम्फ नोड इज most appropriate investigation in squamous cell carcinoma. Okay, thank you.